Hi everyone, this is Shalini Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my another video on my YouTube channel. So thank you for sending all those comments. They really help me to know what you would like to know, you would like to see more on the channel. Okay, so we're going to go through another topic of NMC OSCE. Now this is a really interesting one and it's a very popular station in your exam and it's also probably the most failed station in your clinical skills. So is the one we are talking about is aseptic non-touch technique and we're going to use that to change a dressing in your NMC OSCE exam. So that's what we're going to look at today. So we will look at what is aseptic non-touch technique, what are the most common fails, and what I will give you my tips how to stay safe in your practice. But for that, you need a better understanding of what aseptic non-touch technique is, so you don't end up making those key mistakes. Okay, so you can be quite careful about those key points in your station, and then hopefully that would keep you safe in your practice. But for that we need a deeper understanding of what aseptic non-touch technique is, because this is the skill nurses use a lot. So it needs to be done correctly. If we don't do it correctly, the consequences is giving infection in that wound. Okay, and we don't want to do that for our patients. So we want to keep our patients safe, and we want to prevent any wound infections, and that's why it's really important that we know this, we have a good understanding of aseptic non-touch technique. Okay, so we will look at what are the common fails in your NMC station for this skill and how you can prevent them. Right, okay, let's get started. What is aseptic non-touch technique? So that's in the name. Aseptic means sterile, so it's a sterile procedure. Non-touch means that we do not touch anything on the sterile field to make it contaminated. Okay, so the whole point is not to put any bacteria or anything, any microorganism into that sterile field. So if it ends up in sterile field, it will end up in our patient wound. So we want to make sure everything we do is in a non-touch way, where our environmental, we are not putting anything from the environment or our hands into the sterile field. Technique, because it's a particular way of doing this, so it's called technique. So like I said, it's a very valuable skill for nurses, aseptic non-touch technique. So it doesn't only help you with your NMC OSCE. If you have a better understanding of this, it's going to help you a long way in your clinical practice all throughout your career. And that's what we do at OSCE Nurse Training Cambridge. We make sure you have a deeper understanding of the different procedures or clinical skills and know the logic behind it, know the reasoning why you're doing certain things certain way. Because if you know that, it's so much easier to understand OSCE and understand your station and perform really well. That's the one important thing. Second thing, we are teaching not just for the exam but for your it will help you in your career going forward as a nurse in UK, because obviously back home we may have done things differently, but now we need to follow the NMC criteria, not only just for exam but in our clinical practice as well. We follow the guidance from the NMC. And the third thing is NMC OSCE exam is is moving away from the rote learning. As you can see with the new changes now, that if you fail a station, they might give you a different clinical skill in your exam. Why? Because the whole exam is moving away from scripted or rote learning. Examiner wants you to have better understanding, deeper understanding of things and reasoning why you're doing certain things certain way in your exam. And that's where training comes in place. Definitely with us, we make sure you have a deeper knowledge of everything, because your examiner can ask you additional question, why are you doing this? Yeah, you may be doing it, but if they have any doubt that you are very much scripted, they can ask you, they're allowed to ask you additional question. They will ask you additional question to check your understanding, and if you don't have that, then it would be a problem in exam. So that's why it's important that the way we teach at OSCE Nurse Training Cambridge is very much particular to you understanding the reasoning and logic behind everything. So you can obviously answer your examiner's question, or it's lifelong learning, isn't it? So that's as nurses, we're learning all the time. Practices are changing, research is changing, evidence is changing, and we need to change alongside it. So that's what aseptic non-touch technique is, basically setting up sterile field and then doing your dressing in a non-touch way without contaminating that sterile field, so we can prevent any infection going into that wound we are cleaning. Okay, from then the first thing is things go wrong when we set up our sterile field. Okay, so that's the next screen. So let's look at the setting up sterile field. Now, first thing is you're going to clean this trolley they have given you with Clean wipes with, like, alcohol wipes with chlorhexidine in it. So you're making your trolley sterile. Okay, so there is a particular way you should clean your trolley from furthest to nearest, and the sides and the poles and the second shelf as well. Both shelves has to be ready to set up a sterile field. We're going to set up our sterile field on the top shelf, but we still need to clean the second shelf. So making sure our trolley is clean with alcohol and chlorhexidine wipes. That's the first thing. Second thing is to make sure that when you're opening your dressing pack and things like that onto the trolley, your outside packaging of your dressing pack should never touch the top shelf of the trolley. When you collect your equipment, everything has to be put at the bottom shelf, never on the top shelf, because top shelf is going to set up your sterile field. Then other thing is, when you open your dressing pack onto that trolley, make sure you use a technique where the outside packaging will never touch that trolley. Okay, so you should open your pack away from the trolley and slide it onto your dressing pack onto your trolley, so outside packaging does not touch the top shelf of the trolley, because we just made it sterile. We just cleaned it with the alcohol and chlorhexidine wipes, so we're gonna keep it sterile. So we open our sterile pack onto that. So that's the first thing. Second thing is, a lot of nurses ask me, oh, can I find it very difficult to set up a sterile field with the bag, the bag they have given you in the pack, because there is a technique where you can pick up the bag, put it on your hand, and use that as your temporary sterile glove and arrange the sterile field with that. Yes, you can do it, but it does take little bit more practice to pick up the bag in a way that you do not contaminate the sterile field by touching it anywhere, and then putting the bag onto your hand is a real technique, so you don't contaminate it at that stage. And then you got this bag which it doesn't have a good grip, or it's not like a glove. You have a good grip on it, so you can touch things and apply, and it's only one hand as well, so can be quite tricky. So it's okay, they give you spare pair of sterile gloves, so it's okay to open those gloves separately, put them onto your hands aseptically, and then set up your sterile field with that. So it's absolutely fine. You don't have to, if you struggle with the plastic bag on your hand, which is inside the dressing pack, to use as a temporary glove to arrange your sterile field, you don't need to struggle. You can use a spare pair of gloves, because that's available in your exam. So that's really, really important to think, should I practice that way, because it's given, so why don't I use it? So you can do that if you wish to do so. If you're happy to use the the bag in the pack, then that's fine. If you practice enough and you're happy with it and you have mastered your technique, fine. But otherwise, you can use spare pair of sterile gloves. Another thing is, always maintain sterility. So when you are near the sterile field, make sure that your forearm doesn't touch it. When you're opening things onto the sterile field, your outside packagings do not touch the sterile field. Like, say, if you're opening a dressing, because dressing doesn't come as a part of the dressing pack, you have to add a dressing according to patient wound size onto your sterile field. So when you're opening the dressing packages, move away from the trolley, open it away from the trolley, and then once you're nearly open the whole pack, then you can tip it into your sterile field. So making sure that you are you are not, outside packaging is not touching your sterile field. So that's really important. Another one is no outer packaging, I already mentioned that. Ensure to open all needed items before applying your sterile pair of gloves to do dressing. So when you're ready, you have to open everything onto it, because it's single person technique. So sometime when we see that you are very much want to get your gloves on, do the dressing, but that's okay, but you haven't opened your dressing onto the sterile field, you haven't opened your fluid to cleaning fluid onto the sterile field. So if they are not already open, then once you put gloves on, then you have to take the gloves off, because you can't touch other things with it. You can then you can open your dressing, but then your sterile gloves are not sterile anymore, so you have to take them off, clean your hand, open everything again, and then put new pair of sterile gloves. So it's important that you make sure everything you need to do the dressing is on the sterile field open before you actually put your sterile gloves on to do the dressing. Moving on to the next slide now, applying sterile gloves. So that's where you are going to watch this now little clip. I'm showing you how to apply sterile gloves. Whether you apply it to arrange your sterile field, or then later on apply another pair of gloves which is in your pack to do your dressing, technique is the same. So watch that clip now, okay? Okay, so let's get it done then. So as you can see, I'm starting from the point where my sterile field is set. I've cleaned my hands with my gel. I've already had my apron on when I setting up the sterile field. I have to put the apron on, then set up the sterile field. So I've done that. Now I've cleaned my hands with gel and I'm ready to put these gloves on. So what is the correct way? So we do not contaminate our gloves. So you can see these gloves are in the pack and they both have sleeves. As you can see, they're folded, so they're in there. So the technique here is, if you're going to put that in on your right hand side, if your dominant hand is the right hand side, put that one on first, because it's much easier. So obviously my dominant hand is right, so I'm going to put it on that, but I cannot pick with the right, because it won't go on the right hand then, so that's not going to work. So if we're going to put it on our dominant hand, pick it up with the other hand. So my dominant hand is right, so I'm going to pick up with the left. So I'm going to pick this glove with my left hand side, the right glove, but the inside sleeve. Why inside sleeve? Because inside sleeve is going to touch inside of my arm anyway, so it's going to be coming in touch with skin. So that's okay, but what we can't do is we cannot touch anywhere outside. Okay, so I'm going to hold on to this inside sleeve. I'm going to pick my glove up. I'm just going to step back a little bit, because sometimes if you touch the edge of the trolley, then it will be contaminated. So I'm going to look for I will just look at it carefully where the thumb is on the right hand side. So I'm going to put my hand in and I'm going to get that in slowly. Like I said, inside is fine, because we're touching it inside, it doesn't really matter. So I'm still touching it inside and I'm just putting that on. Okay, so that's fine. So I've not touched anywhere outside of the glove. Now we need to put the left hand now. Okay, so but we can't use the same technique as the other one. We cannot touch from the right hand side inside. So I'll show you in a second what's the logic here. So if I touch now inside the sleeve, at the moment I'm fine. It's sterile hand to sterile glove, it's okay. But the minute I try to put it on, my right hand, which is my sterile hand already, is going to touch bare skin on my left. Then I will contaminate my right glove, so I can't do that. So I need to protect my right glove while putting on the left. So what I'm going to do is I'm going to hook the fingers of this sterile glove in this sleeve. Okay, so they're protected, so they will not touch the bare skin on my left wrist or hand. So now I carefully look for the thumb again and I try to get that in. Sometimes you can struggle with the fingers a little bit. You might have to just adjust a little bit. So try to keep pulling on, pulling on, pulling on, pulling on, pulling on. So as you can see, my right hand is still well protected. It did not touch the skin on the left wrist or left hand. So now if there is little adjustment needed, you can do it, because it's sterile to sterile. So I can adjust if something need adjusting a bit. If my two fingers went on one, now will be the time I will just adjust it and put the fingers in the right place. Okay, so sometimes that can happen. So that's it. So that's what you need to do. And now they are on and I did not contaminate them, and that's the way you need to put them on in the exam. Now we are moving on. So hopefully that clip is, I've also added the link of that clip on to the description of the video below. So moving on, I hope you now know how to apply sterile gloves. Okay, so you have learned that technique. Hopefully that's okay with you now. Okay, so let's move on to the next thing, which is cleaning the wound. What can go wrong when you're cleaning the wound and how you can contaminate the sterile field? First thing is you have to make sure your gloves don't get contaminated either, because your gloves are part of the sterile field now, because you got sterile gloves on at this stage now. So how to protect your hands? First thing is applying the sterile towel. So you have to apply the sterile drape or towel next to the wound line. So how do you protect your hand? Because I've seen, like for example, this is no sterile drape, I'm just giving you example. Say this is the sterile drape. So if you hold it like that onto the edges, when you apply it to your patient, you're gonna touch patient's skin, you're gonna touch maybe their gown or clothes or the bed sheet. So it means your hands are contaminated already. So that's critical fail, because you contaminated your gloves. So always make sure your hands are protected by the back of the sterile field. When you're taking your sterile towel towards the wound, make sure your hands are in them, holding the sterile towel in the middle, like say here for example. So as you can see, my hands are protected from the back of the sterile towel. So I'm not going to touch anything which is going to contaminate my glove. So I will move towards my wound, apply the towel and move my hands back rather than holding it onto the side, which I will touch something. Okay, so I hope that makes a little bit clearer for you. Next thing is dominant hand with the wound. Now in marking criteria they have changed, so you don't have to say dirty hand, clean hand, but the bottom line is you don't need to declare the hand, but the principle still is the same. Dominant hand should be with the wound, and that is staying with the wound, and the another hand is staying with the sterile trolley, and at no stage you should touch those hands. Okay, one hand cannot touch the other. It has to be when you pick up the gauze with the hand which is near the trolley, so you pick up the gauze with that, wet it, and then you do a non-touch transfer. Okay, you two hands cannot touch, and then you clean it with your dominant hand. Okay, so that's really important, that when you're passing the gauze from the hand which is next to the sterile trolley to your dominant hand which is cleaning the wound, but the hands do not touch. Next thing is, so at no time hands should touch each other. Now people say, well, how would I apply the dressing at the end if without two hands? Yes, you can. At that stage, once you clean the wound and dried the wound, after that you still pick up the dressing from the sterile field with your hand which was with the sterile field. So you pick it up with that hand, not with the other hand which was with the wound, but on the hand which is working with the sterile field. So you still pick it up with that. So in older ways we will say that's the clean hand, so you pick up with that hand, but then you can use both hands to apply the dressing. It's okay as long as you do not touch inside the dressing. Then you use kind of butterfly technique to take the dressing has the plastic paper on it, so you can move the plastic paper with both hands and apply the dressing, but you cannot touch inside the dressing. You can use both hands as long as you do not pick up the dressing with the clean hand which is with the sterile field, then use both hands to apply the dressing. That's absolutely fine. And then make sure your dressing is fully secured. That's another quite common fail. You just put it there but you don't press it around, so it's like coming off. So that could be a critical fail as well, because if your dressing is not secure, microorganisms can get inside the wound. So that's also really important. So these were the simple things I wanted to cover with you, and hopefully you have enjoyed the video on watching on how to apply the sterile gloves, because that is one of the biggest fail in this station. So I hope these things are gonna keep you safe in your practice. You got some tips today which you can apply to your real practice with ANTT. So I hope you like the video. If you do, please press the like button and subscribe to my channel. You can also visit us on OSCE Nurse Training .com, and also email us on oscenursestaining@outlook.com. I will soon be back with another video for you. So bye for now.